5+1 Tips for Coping with Postpartum Hair Loss. Fast-growing and thick hair is a desirable pregnancy sign for many women. So appreciate your lovely locks while you can, because postpartum hair loss may occur in the months following birth. Learn more about postpartum depression and how to deal with it. Don't be alarmed. Hair loss after childbirth is typical. It may be a frightening revelation. You're going about your normal hair care regimen, appreciating those minutes alone where you can take care of yourself. When you glance down at your brush and see big clumps of your hair trapped between the bristles. Don't be alarmed, postpartum hair loss is common. Learn more about what causes postpartum hair loss, how long it lasts, and how to cure it using postpartum hair loss solutions. What causes postpartum hair loss? Every hair on our body grows in a cycle that might last 2 to 7 years. Anagen is the active or growth phase of a strand of hair that defines the length of our hair. After some time, the hair follicle undergoes a transition phase before entering its resting phase. Shedding occurs, and the process begins anew. Hormone changes before, during, and after pregnancy can all have an impact on hair growth. It is totally natural to have hormone imbalance after giving birth, and postpartum hair loss is one of the signs of hormonal imbalance. Telogen effluvium is the medical name for postpartum hair loss. The illness, also known as postpartum alopecia, is rather prevalent, affecting 40 to 50% of women in the months following childbirth. Postpartum hair loss happens as a result of your body's abrupt change in hormones, notably the difference between progesterone and estrogen. How do hormones influence hair growth? Estrogen is the primary hormone that influences hair development in pregnant, postpartum, and menopausal women. During pregnancy, your body releases more estrogen, signaling more follicles to join the developing phase of the hair development cycle than the resting phase. You may see fuller, thicker hair at this period. You may also notice that your hair grows more faster during pregnancy than it did before you were pregnant. Following delivery, estrogen levels revert to pre-pregnancy levels, causing hair follicles to enter the resting period and fewer hairs to develop. The hair begins to shed after around 100 days in the resting period. In addition to the changes in estrogen and progesterone during the postpartum period, stress and diet have an impact on hormone levels, which can influence hair development. Thyroiditis, which is caused by thyroid gland inflammation, causes a thyroid hormone imbalance, which can impact hair growth. When exactly does postpartum hair loss begin? Women may notice postpartum hair loss 2 to 4 months after giving birth. The amount of hair loss experienced by each woman varies and is not necessarily related to the quality or quantity of her hair during pregnancy. However, if you had longer hair or experienced a lot of hair growth during pregnancy, your hair loss may appear more severe.